In this lesson, we're going to talk about the next step. Once you've mobilized this sacroiliac joint, working with how the innominate or hip bone moves, it's like a teeter-totter, as we said, and they go in opposite directions. The next thing is to consider the sacrum. Well, the sacrum lies between these two hip bones, and it attaches to L5. So L5, the very lowest part of the lumbar spine, is almost like it's part of the sacrum. So you need to treat it as if it is part of the sacrum. So when this right side usually goes forward and up, the sacrum also goes anteriorly on that side. So if it's moving anteriorly when you press on the sacrum on the left side, it's going to feel a little bit more firm. And now we're going to show you how to treat that. So when you're mobilizing the hip bone to the sacrum, it's very important that you understand where L5 and where the sacrum is. So what you're going to do is you're going to go along the crest of the innominate bone. Some people call this the ilium. Actually, it's the iliac portion of the innominate bone or the hip bone. As you follow this down, it'll actually drop you right at L5. So it drops you right on the crest of the sacrum, and that's where you're going to be in this area when you start your technique. So looking at a patient, you then go along the crest of the innominate bone, it drops down, and right there is a little bump, and that's L5-S1 and the base of the sacrum. So now we're going to work with the sacrum and with L5. Just remember that when you cruise along the crest of the innominate bone, or what some people call the ilium, the hip bone, as you drop down and follow that curvature, it's going to land you right on the sacrum, and that's right where L5 meets the sacrum, what people call L5-S1. Now, because most people are anterior on the right, this will usually feel softer on the right side and harder on the left. And it does feel that way, doesn't it? It feels softer on this side and harder on this side. So I'm going to work now on L5-S1. I'm also going to treat some parts of the middle lumbar spine and the sacrum. So gently arch your back. I'm on the top of the sacrum. And then arch. Now I'm on L5 and 4 and 3 and 2. And that's moving very nicely. If it feels tighter, I'll go back to that spot and now arch your back and hold. That's great. And that's how we loosen up the sacrum on this side, L5, and the middle lumbar spine.